Hi, my name's Leah. I'm a physician assistant here at Grant, and I'm going to lead this discussion today on preparing for spine surgery. Our agenda is as follows. It's very informal the way we do this, but we kind of try to categorize it as a what to expect before surgery, while you're here for surgery, and then after surgery, both here and at home. Most patients who are undergoing spine surgery have tried to avoid having spine surgery in one way or another. There's a lot of things that your surgeon may have suggested prior to surgery, like activity modification, the use of oral anti-inflammatories, physical therapy, possibly an ambulatory aid like a walker, but sometimes those don't help very much, or they help for a while and then they don't help as time goes by. So at that point usually is when your surgeon says, okay, I'm ready to take you to the operating room, we're going to fix your problem. One of the most important things you're going to do between now and when you have surgery is to have your medical clearance done by a group called General Medical Consultants. They work here in the hospital, and what they're going to do is perform a history and physical. They're also going to do some blood work, and the point of this is just to make sure you're healthy enough to undergo anesthesia and have the procedure done. If you don't have it done, you won't have surgery. At that visit, you're going to get discharged with quite a bit of paperwork, but there's one particular paper that I always ask patients to look for in particular, and that would be the one where they tell you which of your medications that you currently take, which ones you're supposed to stop prior to surgery, and which ones you're supposed to continue. So make sure that you look for that sheet in your discharge paperwork. One thing that we really strongly advocate prior to surgery is drinking a lot of water. We want our patients to be very hydrated coming in for surgery, and there's two reasons for that. One is because we do expect you to lose a little bit of blood during surgery. Not a lot, but a little bit. So we really want to ramp up your blood volume. The second reason, and we will discuss this more later, is because when patients take pain medication and have anesthesia, sometimes you get constipated. And so we really want to make sure that we've got a lot of fluids in you prior to this happening. This slide used to be very simple. It used to say, don't eat or drink anything after midnight. But now there's been some changes, so I'll go through those with you. We want patients to stop eating food 8 hours before you arrive at the hospital. So that means if you're supposed to be here at 7 a.m., you need to stop eating at 11 p.m. That includes candy, gum, things of that nature. You can drink clear liquids up until 2 hours before you leave to come to the hospital. If you look at the things in smaller print, it does say, give you examples: water, tea, coffee, which really isn't a clear liquid, but it counts here, and Gatorade or Powerade. We do not, however, want you to put any cream or sugar in your coffee or tea. If you smoke, obviously we want you to stop prior to surgery. That's not always realistic, but if you can't stop, we want you to decrease the amount that you smoke for numerous reasons. The obvious ones are that it causes breathing problems, but there's other reasons as well. And the one that I've seen in my career that is the most striking to me is that smoking tends to cause infections. Wound infections happen more often in smokers than in any other population. If you use alcohol, we want you to be very candid and honest about how much you consume. There's a couple different reasons for that, but one that stands out to me is that patients who consume alcohol regularly are going to metabolize pain medication differently than people who don't drink at all. So it's very important that in order for us to cater to you as an individual, we know everything about you. These are the things you need to bring to the hospital on the day of surgery: insurance cards, photo ID, copy of your living will if you have one, a list of your medications, not the bottles themselves, and any paperwork you've been given. So anything that you have received in the office, anything you received from general medical consultants at your preoperative visit, just kind of stick all that in a folder and put it in your bag so that you have it here to reference if you need to. Other things we want you to bring for surgery: good pair of walking shoes to go home in. We don't want you wearing flip-flops or something that could be a tripping hazard. So nice sturdy shoes, comfortable clothes, things that are maybe a size or two bigger than normal, so they're very easy to move in and easy to put on. A walker, if you own one. If you don't have one, we'll get you one if you need it. But if you have one at home, bring it so we can make sure it's at the correct height for you and be most beneficial at home. Again, don't bring your home medications. If you use a CPAP at home at night for breathing, bring that. We like patients to use their own because it's at your settings already. So do that if you have one. And we say bring only what you need. If you want to bring your phone because you like to play a game when you're bored, or you want to make sure you stay in touch with your relatives, that's perfectly fine, but we don't encourage you to bring your phone, your favorite watch, your laptop, and lots of things that you'll need to keep track of. Your surgeon's office is going to call you and tell you what time you need to be here. That usually happens 1 to 2 business days before your surgery. So if your surgery is scheduled on a Monday and it's Thursday and you haven't heard from them yet, don't fret. You will probably get that call on Friday. Other things on the day of surgery, or I guess I'm at the day of surgery now. You can brush your teeth the morning of surgery. You can take any pills you've been directed to take with small sips of water. And you can wear anything that you need to make you functional, dentures, glasses, things of that sort. This says contact lenses. Not a big fan of contact lenses on the day of surgery because your eyes can get dry. So I would wear your glasses on the day of surgery. If Dr. DeGenova is doing your spine surgery, you're going to check in at bone and joint right inside of where the valet parking is. There's a little half moon desk there that you've probably been at before if you've come to see him in the office. It's the same building. You're just going to go to a different part of it. So you're going to check in at the desk. This particular slide says you're going to get your temperature taken. Everything's changed a little bit with COVID, so those types of things vary. And right now we're not doing temperatures, but we are asking patients questions to make sure that they don't have any signs or symptoms. Once you check in, you're going to be escorted to the second floor. There's some elevators that go to the second floor where the waiting room is. Then you'll stay there until your nurse comes back to get you and take you to the surgical preoperative area. Right now, we're only allowing 1 visitor for each patient, and when you come in with that patient, if you leave, you can't come back right now. That should change as time goes by, but that's our current policy. If Dr. Lakatos or Dr. Gabriel or Dr. Shahadi is doing your surgery, you're going to check in across the street, not at the Bone and Joint Center. You're going to be over where it says the emergency room entrance is, just to the right of that. It's the surgical heart building. You're going to check in there, and there's a desk, as you can see here on the slide. Some very nice people working there. You will tell them who you're having surgery with, and they will take you also to the second floor where there's a waiting area prior to going to surgery. Regardless of which side of the street you're on, once you get here and you're in the preoperative area, you'll sign any consents that still need to be signed. You will talk to your nurse. They'll go over your allergies, your medications, things you said before to other people, but we like to do a checks and balances system here. And any additional testing that needs to be done will be done in the preoperative area. Usually that's a little bit of blood work or something along those lines. This is also where you're going to meet your anesthesia provider. That's either going to be an anesthesiologist or a nurse anesthetist or both. This is a great time to disclose any issues you've had with anesthesia in the past. If you've gotten a lot of nausea afterwards, or if there's certain medications around anesthesia that you know don't work well for you from past experience, definitely bring that up here. They'll give you an IV, and they may give you a little bit of medication to relax you a little bit through that IV if you're nervous. A couple pearls about being in the operating room. When they wheel you back to the operating room, it is cold. There's a couple reasons for that, but it is pretty darn cold, especially when you're just wearing a hospital gown. We keep it cold because that helps decrease our rate of infection, and because the operating room staff, including your surgeon, wears a lot of stuff that doesn't breathe very well, and so it gets really hot for the individuals that are in there. There's a lot of people usually walking around in the OR getting things ready for your surgery. So you may see 6 or 7 individuals, and that's very normal. You will also be hooked up to a couple pieces of equipment like a blood pressure cuff, a pulse oximeter on your fingertip to measure your oxygen, and some leads on your chest so that we can track your heart rate and such. That's all very normal, not a sign of anything wrong. You will either wake up with a brace on or there will be a brace nearby for most spine surgeries. Some of the surgeons have their patients fitted for braces preoperatively in the office and you bring the brace with you. If that is not the case for your surgeon, then we will have you fitted for one while you're here and it'll be put on while you're here. You will wake up in the recovery room. Most people don't remember being in the operating room when they wake up, but they're in the recovery room, and you're usually there for about an hour. You have a nurse that checks on you, looks at your vital signs, makes sure everything's going well, and then you'll be transferred upstairs to your private room. After surgery, your surgeon will discuss with your family anything that happened in surgery, tell them how it went, if it was as expected, things of that nature. And then usually the family stays in the waiting area until the patient goes to the private room on the 3rd or 4th floor of Bone and Joint. Once you're in your private room, there is when your family can come visit. All these people listed on this slide are part of your care while you're here. I don't go over them all individually because that's boring, but my point here is that it's a collaborative effort. Everybody here works together to provide an excellent care for you and a good experience. We will go over some of these individually as the class goes on. After surgery, you will have a dressing on either your back or your neck, or the front of your belly if the approach is that way. Your surgeon will tell you. The dressing is usually changed at least once while you're here, sometimes 2 or 3 times. A little bit of drainage from your incision is normal, and it's nothing to worry about. And some surgeons use a drain to kind of get some of that drainage out. Little tube that will be inserted during surgery. You won't feel it being inserted, but it comes out of your neck or out of your back into a little bulb, and that bulb collects the extra blood. We want that sometimes so that that extra blood doesn't accumulate under your skin and then cause swelling and discomfort. And if you do have a drain, it's usually pulled the day after surgery. So one thing I like patients to know and be very aware of coming in here is that this is not the Hilton. We try to make it a great experience, but you will be bothered a decent amount by nurses and techs and people that need to do things that they need to do. So your night shift nurses will come in and they're going to be asking you about your pain level and anything else. They're going to check your blood pressure, and they're going to get a blood draw usually at about 5 a.m. the day after surgery. So you'll probably be awoken a couple of times. Also, your surgeon usually comes around the morning after surgery, or his resident, and that's often early as well. And then you'll have physical therapy twice a day and occupational therapy once a day while you're here. And so there's a lot of people that are in and out, and it might be hard to keep names straight, but we try to help with that by having this whiteboard in each room. It's a very nice tool for patients. We put the names of your care team on that board, as well as what your goals are with physical therapy, and some of the do's and don'ts will be up there to remind you. And then at the bottom of that board, you've got when your last dose of pain medication was given and when your next one is due. So that's a nice reference for patients to know and kind of keep track of how they're doing and when their medications are due. After surgery, we start everybody on a clear liquid diet. Nobody really likes that, but we have to test the waters and make sure your belly's going to tolerate it. If you're taking in the clear liquids, you're doing well, you're not nauseated, we will advance your diet pretty quickly so that you can have normal food. One thing that we like you to be very aware of, though, is that there is a complication that can happen. Doesn't happen very often, but it can happen. It's called an ileus. That's when your bowels don't just slow down from surgery and from anesthesia, from your pain meds, but sometimes they kind of come to a stop. And if that happens, you're not going to feel good. Your belly's going to start to bloat out, and you're not going to be passing any gas or anything like that. If you feel any of those symptoms after surgery, let us know as soon as possible so we can give you something to help combat that. Another complication that we want to avoid is pneumonia. After surgery, when you've got pain medication on board, you're not taking great big deep breaths like you normally would. So we're encouraging you to do coughing and deep breathing exercises and to use this incentive spirometer. Your nurse will show you how to use that. But we really want to work on getting your lung volumes as great as we can and get that air exchange. One of the best ways to do that is for you to get out of bed and walk. So we're going to initiate that fairly quickly right after surgery. Also, changing positions in bed can help. Another thing we want to avoid is a blood clot, a DVT, otherwise known as a deep venous thrombosis. It doesn't happen as often with spine surgery as it may happen with, say, hip or knee replacement, but it can still happen. So we take precautions. We have you wear those lovely hose there. We also put the pumps on your lower legs that act as they constrict and release, and they help stimulate blood flow in your legs. But again, the most important thing you can do to avoid this complication is to get up and move. Patients always want to know about pain. Am I going to have pain? Yes, you are going to have pain. It's inevitable. And we can't eliminate your pain. If we did that, you probably would stop breathing, and that's not good. So we will do everything possible to address your pain and keep it under control. And we understand that every individual is different. Some people are on pain medication before surgery, so they're going to need a little bit more afterwards than the average bear, and that's okay. But we try to employ what's called a multimodal approach. We don't just use narcotics. We also look at nerve pain medications, muscle relaxants, lots of different types of medications to keep your pain under control. And we will decide that collaboratively. We want you to keep in mind that narcotics, and you probably already know this, are very highly regulated nowadays. So it's very important for you to secure your pain medication when you're at home. Don't let anybody else have any. And don't get your pain pills filled at different pharmacies. They call that pharmacy hopping, and it's very, very bad. So if Dr. DeGenova or your surgeon has you fill your prescription at one pharmacy and then he gives you a refill, don't go have it filled somewhere else. That's a red flag to a lot of pharmacies. You may have some out-of-pocket costs for your prescriptions, but we do everything we can here to make sure that you don't, or that they are minimal. So rest assured that we will look at your insurance and we will try to do whatever we can to make it as cheap as possible for you. GoodRx is a website and an app that can help with that as well. If you go to the pharmacy and your pain medication or whatever medication you're getting filled costs more than you'd like, you can always look at this website. You can punch in your zip code and the medication, and it will oftentimes give you a coupon for a lesser cost than what your insurance would have you pay. So keep that in mind, and that's a good thing to know about in general, not just for this surgery. So one other complication that we want to touch on is that you can get constipated. That is a very common complication after this, and it's usually due to pain medication. So we strongly advocate that you increase your fiber intake after surgery, really drink a lot of clear liquids, particularly water, and we will prescribe a stool softener afterwards for you to take it home if you need it. But again, moving is key. So at this point, you're going to hear from one of our physical therapists. They're going to walk you through what we do for you while you're here and expectations after surgery.
Hi, my name's Lori Nesselrode. I'm a physical therapist on the Bone and Joint Unit. I want to talk to you a little bit about what to expect in physical and occupational therapy during your hospitalization after your spine surgery. To start out with, I want you to know that you're going to be up and moving right away after your surgery. That same day of your surgery, you'll come up to our unit and you'll start ambulating that afternoon. So, we really want to get you, make sure that by the time you go home that you're doing all the things that you need to do to function at home. One of the main things that we teach you in physical and occupational therapy are the back precautions or the back protection principles to go home and be safe. We want to make sure that you know the three basic rules of no bending, lifting, twisting while you heal. No bending way far forward. That will, bending to tie your socks and shoes. We'll want to show you different ways to do that so that you're not bending and at your back too far while you're healing. We want to make sure to teach you not to lift more than about 10 pounds. So no more than about a gallon of milk while you heal. And then the last one is no major twisting. So we want to make sure you're keeping that back as one unit as you heal. You're still allowed to move. You're still allowed to function at home, but those extreme movements will really, to avoid those, you're really going to be safer, you're really going to have less pain, and you just heal better. So we say this is no BLT. It's an easy way to remember it. No bending, lifting, twisting. No BLT. So we make sure and teach you that and make sure you know that by the time you go home. Another thing that we do in physical and occupational therapy is we help you determine what you need at home as far as equipment. Some common things. You may need a wheeled walker at home. You may need an elevated toilet seat. You may need a shower seat. We'll help you determine that depending on how you're functioning after your surgery. But that's one of the things we'll make sure that you have access to or know the things that we can provide for you to make it easier for you at home. By the time you go home, here's the goals that we have for you here in the hospital to be able to go home and feel like you're going to be able to function safely. We make sure you can get in and out of the bed on your own or maybe just with a caregiver. We teach you how to do the log roll where you're you're lying on your back and then you roll to your side, drop the legs off the edge of the bed before you get up to a sitting position. That keeps your back as one unit. And also when you're lying back down, we want you to sit first, lie down to your side, and then swing your legs up and in, and then roll back to your back. So that keeps your back in a comfortable position, makes it a little easier to get in and out of the bed. We also, by the time you go home, we want you to be able to walk up and down the hallway safely. So a lot of times you use a wheeled walker for that at first. Occasionally people can walk on their own, but a lot of times you'll need a little wheeled walker for a little bit of support at first. We make sure you can go up and down any stairs that you have. So if you have 4 steps at home, we make sure you can go up and down 4 steps with the rail or without a rail. We'll simulate what you have at home and make sure you feel comfortable with that. Another thing that we do is we help make sure that if your doctor orders a brace, we make sure that you know how to take that on, put that on and take it off. We make sure that you know how to adjust it. We make sure that you know when you need to wear it and when you don't have to wear it. So we do make sure that you're comfortable with your brace before you go home. The occupational therapist will really make sure that you know how to handle yourself in the bathroom, getting in and out of a bathtub or out of the shower, things to do like getting up and down from the commode, that kind of stuff. And another big thing occupational therapy does is working on any tips that they have to help you get dressed and undressed at home. So there's a lot of things that will help you do just to make your life a little easier after your surgery. Like I said, we'll see you several times while you're here until we've met all these goals. You won't be here very long, but just so you know, we are in the maroon colors. We're both physical and occupational therapy. Expect to see us a number of times and expect to not get a lot of rest because we're always going to be in there helping you get up and move and get you out and back to your own home setting. We thank you for choosing us for your therapy needs, and thank you for having your surgery with us. We look forward to working with you.
Hi folks, I'm Deb. I'm one of the care management team. One of us will be assigned to you to work with you through your stay here at the hospital. Usually you're going to be here with us for 1 to 3 days, depending on which kind of surgery you have and how you progress. Our goal for you is for you to return home. Obviously, you folks need to consider some rehab before you get home, but we'll talk to you about that as you progress, what those needs are, and what we may be able to coordinate with your insurance company. We're not going to proceed with anything that may not be covered by your insurance. Obviously, folks are more comfortable at home, and there is a much less likely risk of you developing any infection if you would go anywhere besides returning to home. We recommend that you're going to have some family that's able to help you for at least the first week or so once you get home. You're going to need to get sort of a system built to understand how do I get up, get dressed, get my breakfast, sort of do the daily activities of living, and then once you sort of get your system built, then you'll be a little more independent and you won't require as much assistance from family or friends. A lot of things you can do before surgery to prepare yourself, to make yourself more independent and obviously safe once you get home. Move any items that you use on a normal daily basis on top of your counters, on top of your shelf, so you can get at them easily and safely. You know, the easy reach for anything in your bathroom is what you want to consider, as well as in the kitchen. Those things you use on a regular basis, have those out and ready to access. Remove anything you could possibly trip over, such as throw rugs or extension cords. And you may want to consider using a nightlight in the bedroom or the bathroom for the first few days. You were at home, then you were in the hospital, and now you're at home and you're on narcotics. So waking up in the middle of the night, it was just going to be helpful to have that nightlight to orient you to where I am right now. Also consider what you may need to do with your pets. Sometimes pets may be a little skittish if you're using a walking device. You don't want them to get underfoot while you're trying to ambulate. So if you need to consider either kenneling or crating your pets for a short period of time, consider that before surgery. Make things easier for you afterwards. Cleaning, laundry, those kind of things, anything you can do beforehand, again, is going to make things easier for you once you finally are discharged here from the hospital. Preparing some meals will also be helpful. If you can freeze some things, put them where you can easily get at them. Make sure you have access to all those pans or whatever you need to be able to get at them, and it'll help you make things easier at home. Your discharge plan is going to include obviously the therapist, your surgical team, one of our team, either a nurse or a social worker, and then you and your family will be involved in coordinating your plan for discharge. All your plans are going to depend on how you and the therapy staff progress. Each day you're going to get your therapy, and then we're going to see where you are in relationship to your goals to be discharged home. We'll communicate those things to you daily so you have an understanding of what we need and when you're ready to meet those goals and go home. Obviously, the insurance company is going to play a role in your discharge plans, but we work with individual insurance companies to make sure that we've got an adequate, safe plan that they will cover as far as what your needs are going to be. You're going to need a ride home from the hospital. You need to have a family or friend available to drive you home, as well as to drive you to any follow-up appointments that you may have after surgery. I will tell you that most insurance companies are not going to cover any transportation home from the hospital. So again, this is one of those things, if you do it before surgery, you'll be better off than trying to scramble afterwards. You're also going to need somebody to go to the pharmacy for you the day you leave the hospital. So consider building that into your time frame. If somebody's on some time restraints and you've got somebody coming to pick you up, make sure they can get you home, go to the pharmacy, and then get back to you. Again, just things that will make life easier. You're going to need some medical equipment once you leave the hospital after this procedure. A lot of folks are going to need one of the front-wheeled walkers, 2 wheels on the front. The wheeled walker is covered by your insurance company if you have not received one in the past 5 years that has been billed to your same company. So basically, what we'll do is if you need one, we'll order one, and if it comes to the point where you've had one previously, we'll have that discussion with you, and that's your choice. Okay, Medicaid patients only are going to have the elevated toilet seat and the shower chair covered for home use. You're going to need one, but the only folks who are going to get paid for are the Medicaid patients. For those private insurance folks who are not going to have them covered, the cost if we would dispense one to you would be $54 for the toilet seat riser and then $78 for the chair to assist you while you're in the shower. I will tell you that the elevated toilet seat and the shower chair can be purchased much cheaper than the $54 and $78 if you would choose to go to Walmart, go to Amazon and get those ordered. Your cost is going to be significantly less for that. And the final piece of equipment that we would recommend would be what's called a hip kit. It is the long-handled sponge, the shoehorn, the sock aid, those kind of things that are going to help you with your bending limitations. Again, those would not be covered, and those would be easily accessed as well on Amazon.
So I did not create these slides personally, but I did add this first bullet point to this talk because it is near and dear to my heart because I have worked in this field for 20 years, and I am never surprised at how many patients beat themselves up for how tired they are for weeks after surgery. So I'm here to tell you that that's normal. If your body's telling you that you need to take 3 naps a day for the first week after surgery, that's okay, as long as you're balancing it out with movement as well. So tiredness is normal after surgery. Fatigue can also be brought on by not eating well, so we strongly encourage you to eat well after surgery. Easier said than done sometimes because patients often tend to have a little bit of a sour stomach after anesthesia or after they've had a lot of pain pills and things like that. So if you don't feel like you have a good appetite and you're not getting the nutrients that you need, go to the store and get something like Ensure, something that you can chug and has all the nutrients that your body needs to help you heal and recover. And of course, take the medications that have been prescribed by your surgeon or his resident or his APP like myself. Touching on the incision a little bit more, you can experience some redness, and that is not always a sign of infection. As your incision heals, sometimes it is a little bit red down the middle, and that's okay. Now, if the redness is spreading all the way across your back, of course, that's something that you want to call your surgeon about. But a little bit of redness is normal, so is a little bit of swelling, and so is bruising. I've had patients over the years who have been just mind blown over the fact that they would bruise on parts of their body that they don't feel like were even involved in their surgery. But it's weird how that happens sometimes, but yet it does. So don't be alarmed if you had neck surgery and you have bruising in the opposite armpit from where your incision is. That's okay. It is normal, again, to have a little bit of drainage from your incision as well. That usually stops by the time you're discharged from the hospital or within a day or two. If it doesn't, of course, you need to call your surgeon. A little bit more about the incision. There's a lot on this slide, but the point of this is that you can shower when you go home. Every surgeon lets you shower. You just have to look at your specific discharge instructions as to when that is going to be. For some, it's day 2. For some, it's day 4. So really look at those discharge instructions. The one thing they all agree on is that you do not want to scrub your incision. So don't take a loofah or a washcloth or anything like that to wash your incision. Just put some soap and water on your hand and you can touch your incision, that's fine, but don't scrub it. You also don't need to use a dressing if there's no drainage. So if your incision is dry, you do not need to cover it up. Some people like to cover it up because they like a buffer between their neck brace or their back brace and their clothing or their clothing or brace and incision. Sometimes that friction's not good. So if you want to put a dressing on as a buffer, that's completely fine. No powders, creams, no Neosporin, nothing like that. And obviously we don't want you to submerge it. So don't get in a hot tub, a swimming pool, or a bathtub where your incision would be underwater until after your surgeon says that's okay. We spoke about the brace before, but we like to reiterate here that you will be wearing it particularly when you're in the car and when you're walking long distances. When you're laying down or sitting, you usually do not need it. Some patients like the way it feels, gives you a little extra support, but we don't want you to wear it too much because then your core or your neck muscles get lazy because they get dependent on the brace. So make sure that you wear it just as often as your surgeon says. And of course, as the physical therapist said earlier, no BLTs, no bending, lifting, twisting. Now that doesn't mean that you can't bend over at all. If there's a magazine on the counter and you want to lean over a little bit, you can do that. We just don't want you touching your toes and doing extreme movements. So each day we want you to try to do a little bit more, but we understand that your recovery is not a trajectory that goes up at a steady angle. Sometimes it's a little bit bumpy. Sometimes you're going to have a bad day. If you feel like you're feeling great one day and you go out to dinner and you go to church and you do all these things, the next day you might be pretty sore and you might kind of pay for it. But unless you've done the BLTs to an extreme, it's very unlikely you've done anything to damage your surgery. So try to do a little bit more every day, but understand that some days you might have to rest a little bit more as well. Don't drive until your surgeon says it's okay. Don't play any sports. Don't do any impact activities where you're jumping or anything like that until they tell you. Don't use any exercise equipment. Patients often ask me, well, can I just walk on a treadmill? We would prefer you walk outside or on an indoor track or something that's very level because treadmills sometimes trip people up, and until you're really, really steady on your feet after surgery, that's not recommended. We say don't sit longer than 30 minutes at a time. That's just a ballpark thing. And the reason for that is the longer you sit, the stiffer you're going to be. If you have an hour-long TV show you want to watch or a 2-hour movie, you don't have to get up in the middle of it. But know that when you do go to get up, you're going to be a little bit more stiff than if you were to do it in short increments. And lastly, it's okay to resume sexual activity when it's approved by your surgeon. When patients have things like hip replacements, there's a definitive line that says you can't do it until you're 6 weeks out. It's a little more of a gray area with back and neck surgery, so definitely talk to your surgeon about that. So here's our last slide. The main point of this slide is we want you to call your surgeon if you have problems. If you have any wound issues, you have a low-grade fever, your pain's not controlled, your wound is starting to separate a little bit, or you've got some drainage that is kind of malodorous, or it has a color to it that's greenish-yellow, call your surgeon. Have them see you. Most of the surgeons have ancillary staff that can see you in their absence if they're somewhere else, but somebody needs to look at you, and we don't want you to go to the emergency room. You may ask why. Well, because they don't know what you had done, and your surgeon knows that. We don't want people messing with you that don't know everything about you like we do. So call your surgeon if you have any problems. The one time you should go to the emergency room, though, is if you are having any signs or symptoms of a DVT, of the blood clot we talked about earlier. The 3 signs that we want you to watch out for are unrelenting calf pain. If that comes on, you can't get rid of it no matter how you stretch your leg, and you've used a heating pad and that pain won't go away in your calf, that could be a blood clot. So could a warm, red, hot, painful area on your thigh. That could be a blood clot as well. So if you develop that, take note. Lastly, if you get chest pain or shortness of breath, that needs to go to the emergency room. So any of those 3 things, definitely go to the ED. Anything else, please, please, please call your surgeon and have them see you. So if you have any other questions, we want you to refer to your spine guide, the spiral bound book, your discharge instructions that you're going to get when you're here at the hospital, and you can always call your surgeon's office and clarify anything between now and surgery. Thanks a lot.